Okay, I'm starting this video to scan the area. You can't turn the camera around while you're recording, so I'm just gonna show you everything up and down. And that sign on the wall up there is a Spanish. I don't know what it says.
Who says wall?
I don't know Spanish.
The wall. I don't know.
And then I'm going to show you my machine. I just erased everything from like the NMES lab, so. Okay, and then I also have an eye relief, so I'm just going to use the pads from that. So I'm knocking, hand sanitizing, okay. Hello, Mr. Slavo, how are you?
I'm good, how are you?
Good, my name is Jen. I'm gonna be your student physical therapist assistant this afternoon. What brings you in today?
My shoulder.
Your shoulder. I was reading in your chart that you're suffering some pain in the right shoulder from adhesive capsulitis, which is also known as frozen shoulder. Can you tell me what your pain scale is right now?
It's like a 6.
It's a 6? Okay. So what we're gonna do is I'm gonna put these pads on you. We're gonna do some IFC to the shoulder, which is gonna decrease some of that pain. Sound good? Cool. Before we get started, I just have to go over a couple things with you. First, do you have any metal in the area of that we're doing? Okay, good, because we can't put any of these pads, electrical current over metal. No bueno. It's the only Spanish I probably know. And then also, we're not putting, another precautious thing that we're gonna do is monitor the skin, make sure there's no irritation happening afterwards or during, anything like that. We're not putting the pads over your carotid. Are you really eating candy right now during my skills check?
Sorry.
We're not putting the pads over your carotid sinus, so we're good with that too. And then there's, I'm gonna check your skin in a couple minutes. Do we have any active bleeding or sores in the area at all? No? Okay. So, like I said, I'm gonna go ahead and check your skin, which means we're gonna have to do some hands-on. I'm gonna have to lift your shirt, clean the skin, put the pads on, check and everything. Again, hands-on, is that okay with you?
Yes.
Good. So I'm gonna go ahead and check the skin. Everything looks good. All right. I'm gonna go ahead and clean it off with water. Just get the excess oil in the area, make sure the pads stick well. Okay. All right, we're gonna go ahead and get started. I'm gonna pop this pillow under your arm. I'm gonna pop these pads on you. I know they're cold, I'm sorry.
That's really cold.
I know. I didn't put them in the freezer, I swear. All right, and I know we can't put the pads over any bony prominences, so I'm putting it over the supraspinatus. I'm gonna show you, can you lift your sleeve up for me? Okay. All right, so I'm hooking up. So just so you know, Mr. Slavo, these two pads here are gonna be on one channel, and they're gonna talk to each other across the area. And then these two are the second channel, and they're gonna go over to cross the area, okay? I'm gonna go ahead and plug these in, and I'm gonna set my parameters. So I'm gonna do sweep off and then scan off, and then I'm also gonna do the carrier frequency at 4,000 hertz, and then the beat frequency is going to be 100 beats per second. So after these are plugged in, I'm gonna go ahead and turn this on. What you're gonna feel is a nice tingling. It might even be a vibration kind of feel. This is not supposed to be super uncomfortable. We do want to turn it up to where it's right at the border of being uncomfortable, but it's not supposed to be painful. This is going to decrease the pain, okay? It's supposed to be nice and comfortable for you. A nice sensation, easygoing feel, okay? So I'm turning the leads on. Let me know when you feel something first.
Okay.
You feel it?
Yeah.
Okay, so let me know when it's right at that border of being a little uncomfortable, but it's okay. We don't want you jumping, so I'm gonna turn it down. We don't want a muscle contraction. All right,
that's
so
good.
Okay, so we're gonna stop at 20 milliamps then. I'm gonna leave this on for 30 minutes. I have a bell here for you, and I have a bell here for you and a timer. Okay, we're doing this for 30 seconds. And I'm gonna come back and when it's all done, okay? I'm coming back. All right, your timer's up. I'm gonna go ahead and turn the machine off and I'm gonna take the pads off. We're gonna inspect the skin again. Sorry, I'm not trying to give you a good waxing. Okay, inspecting the skin. Everything looks really good. Okay, so at the beginning of your treatment, you said that your pain scale was a 6 out of 10. How's your pain now?
Like a 4.
Like a 4. Okay, good. So what we're gonna do is I want you to, even though your pain is down and you feel pretty good, I want you to take it easy, okay? Don't do anything super crazy. I know you wanna go home and probably do some stuff around the house, but just be careful with it. Also keep in mind about how your pain feels throughout the day, so when you come back next time, let me know how it treated you, okay? So if this does pretty well and it keeps your pain down for next treatment, we're gonna do it again at the end of every session that we have, okay? Do you have any questions for me, Mr. Slavo? Okay, and we are all done for today.
Okay, bye.
I also wanted to tell you my rationale. My rationale is we are doing gait control theory. So with the carrier frequency set at 4,000 hertz, it's going to be a shorter pulse duration. So what we're doing is we're depolarizing A beta to inhibit the interneurons that are going on between the pads to stop the signal, the pain signal, from getting to the spinal cord, shutting off that gate so it doesn't go up, and it's giving my patient pain relieving effect, analgesic effect, to decrease his pain.